Hello, my name is Grace Fitzgerald and I did my report on the effects of bipolar disorder on the brain. What is bipolar disorder? Bipolar disorder is a recurrent chronic disorder characterized by intense fluctuations in mood, state, and energy. Bipolar disorder includes episodes of mania, hypomania, and depression. Mood swings are persistent and result in distress and impairment. It leads to cognitive and functional impairment and raises mortality rates, particularly death caused by suicide. Who does bipolar disorder affect? More than 1% of the world's population are affected by bipolar disorder. It crosses over all nationalities, ethnicities, and socioeconomic statuses. It is one of the main causes of disabilities among young people. There is consistent prevalence across different cultures of bipolar disorder. Bipolar 1 versus bipolar 2. Bipolar 1 disorder includes one manic episode, and major depressive episodes are common but not required for diagnosis. With bipolar 2, at least one hypomanic episode should be present. Major depressive episodes are required for diagnosis. Current research being done on bipolar disorder. Many studies have been done to reverse the shrinking of the frontal cortex brought on by bipolar disorder. This includes intensive lithium treatment. Researchers in Australia have performed studies on the medial prefrontal cortex of bipolar patients while they were performing tasks that required decision-making. The research showed that medications can make a slight difference in helping patients with emotional outbursts, but nothing has truly helped with medial prefrontal cortex activity. Some common interventions for bipolar disorder. Early detection and intervention is crucial to living a fruitful life with the disorder. Cognitive behavioral therapy is also very common. This identifies maladaptive and cognitive barriers to patient recovery, works on stress and lifestyle management, and shows best success with pharmacotherapy. Motivational interviews have also been proven as helpful in bipolar patients. Diagnosing bipolar disorder. It's difficult to diagnose bipolar disorder in clinical practice due to symptoms mimicking those of other common mental illnesses such as depression and anxiety. There are currently no valid biomarkers for the disorder. Detecting manic episodes are crucial to diagnosis. Diagnosis strategies are on the rise in psychiatric and psychological treatment. How does bipolar disorder affect the brain? When bipolar disorder is allowed to progress, the prefrontal cortex shrinks. Patients with bipolar disorder have also experienced trouble with face recognition because they have an underdeveloped fusiform gyrus. The medial prefrontal cortex in bipolar patients is also particularly underactive, which causes their impulsive behavior. My interest in the topic stems from my family. I took a specific interest to this topic because my brother and grandfather have both been diagnosed with bipolar 2. I was interested in learning about the ways their brains differ in function from the typical brain. The most important thing I learned about bipolar disorder was that patients affected with the illness have legitimate differences in the size and functions of their brain. Oftentimes it's easy to write off mental illness as someone being moody or just not able to handle life properly. It was important for me to learn that people affected with the disease have a slower and smaller prefrontal cortex than most people and therefore have a harder time making rational decisions. This has helped me in understanding where the effects of the illness stem from. Reasons others should know about bipolar disorder. More than 1% of the population are affected by the illness, and people are affected across all cultures. This means most people probably know someone affected by the illness and should understand how to treat it. The more people that know about the illness, the more attention and help people with the illness will receive.